My name is Serena Chen and I'm an SPOR student currently at the School of Public Health at the U of A, and my research is on falls in seniors after they've had hip and knee replacement. Well, in my 6 years of working with seniors, I've noticed really how common and how devastating falls can be. So oftentimes after a senior falls, they stop engaging in the physical activities that they typically would enjoy, and they lose independence, and often they're left with chronic pain. And the reason I want to work with seniors is because I feel like they are quite insightful and are very willing to share their knowledge. I feel like most research is very isolated to an academic environment. It is really hard for the public to get involved and to benefit from that research directly, which is why my research is different. I want to go into the community and I want to interact with them and come up with research ideas with them together. My research will be very patient-oriented, which means working with the community, working with the seniors in a way that hasn't really been done before or isn't commonly done. So what I will be doing is going to involve them in almost every step of the research along the way. So kind of going in, coming up with a research question with them together, seeing what their interests are, what they want to know about falls, and then involving them throughout the research process, and finally relaying that information back to them so that it has a direct benefit on the community.
Well, unfortunately, in the home, falls happen most often on stairs. And there's probably a lot of different reasons for it, one of it being that the building code in homes is quite different than it is in public buildings. It's much more stringent in public buildings. I think Serena's bang on when she talks about involving seniors in the research. It's easy for us to stand back as practitioners and have ideas about what might be contributing to falls and what information we think they need. But we're not in that age bracket. We don't face the same issues. And so involving them, I think, is really critical to knowing that you're able to provide what is actually required and asked for and needed, as opposed to just making it up and hoping you've hit the mark. Even looking at how do we prevent falls, there are so many different risk factors. It's hard to do research in all the different areas. It's kind of like a puzzle where we're trying to figure out what are all the pieces that fit together that contribute to somebody falling, or what are the pieces that we need to fit together to provide the correct kind of service. So it all needs to meet together, and you've got to be able to finish the picture and finish what that puzzle piece looks like.
Yay! I think this is the most important, is that we work with them to find the answers that they are interested in and come up with solutions that are actually going to be impactful and beneficial towards the people who will be applying this research to. I've had a really positive experience with SPOR. They've provided a lot of opportunities for all their SPOR students. So for example, they have workshops where they can really showcase what patient-oriented research can do for a community and the positive impacts that it's had, and it's really inspirational.